Insurance carrier and brokerage background, 9 years with Stream Benefits Group, and is certified in patient protection and is an Affordable Care Act professional. Scott's here today to share with us how the Affordable Health Care Act is affecting business. Scott.
Thank you, Chris. Can everybody hear me all right?
Oh, yeah.
I'm finding a little bit of a cold here, so bear with me. But a couple things. First off, you probably think this is the Stream Chamber of Commerce today and everything. With Don and myself, Rick would be here, but he's down in Jefferson City. But my lovely wife is over here. My wife, as some of you don't know, works at Frank Mistretta Chiropractic. Debbie, stand up, please. Please note that working at Mistretta Chiropractic she does need some type of battle pay and everything, but she's having a good time and really enjoys it. So, other thing is this medal around here that I'm wearing. It reminds me of the Olympics. Who here has been watching some of the Winter Olympics so far? Anything get going? All right. How about Bob Costas' eyes? Aren't those those are some lovely things to take a look at. And that leads us into healthcare reform. How's that for a segue? All righty, let's get this one started. A little bit about myself. As was mentioned, I've been in the insurance industry for about 29 years. A couple different things. I've been on the insurance carrier side as well as the broker side. So I have experience with both Blue Cross, MetLife, Lincoln National, as well as on the insurance carrier broker side. About 9 years ago, I started my own insurance agency, Stream Benefits Group. We work with small, mid-sized businesses as well as the self-employed, helping them with their health insurance, dental, life, disability, life insurance, and voluntary worksite programs. This past year, I've also become certified in the Patient Protection and Affordable Care Act. There's been a lot of things that have occurred in this past year as far as getting ready for the major implementation of the Affordable Care Act. And today what I'd like to do is talk about the law and how it impacts everyone, because it does impact everybody in this room. Now, since I've only got 3 hours to speak this afternoon, I'm only going to talk about pages 1 through 5 of the law. It's 2,600 pages of this law. Actually, I'm going to give this speech at about a 20,000-foot level. All right. I'm going to try to talk about just how things impact you, some of the changes, some of the things that have occurred in the past and will be occurring in the future, and what it means. All right. Now, one thing is the law has actually been around for about 4 years now. March 23rd, 2010 is when the law went into effect, and immediately some things did take place. The law goes by about 4 different names. A lot of people refer to it as Obamacare. A lot of people refer to it as the Healthcare Reform Law, also the Patient Protection and Affordable Care Act. Today I will be referring to it mainly as the Affordable Care Act, or ACA. There's a lot of acronyms in this law, and that just happens to be one. But it all is the same thing, alrighty? Now, there's some key components that have already been implemented with the law. First off, extension of coverage for your children up through age 26. In most cases, it's the month in which that individual turns 26. Who in this room has had a child that has actually been affected by this law being implemented of going up to age 26? For a lot of people, that's been very good. For a lot of individuals, that maybe their child has completed college, hasn't been able to find a job, but they've been able to stay on the parents program, this is helped in that situation. Elimination of lifetime limits. There were a lot of insurance programs prior to 2010 that had a lifetime limit of maybe $500,000, $1 million, maybe $2.5 million. Now it's unlimited. There can be no more limits to the lifetime maximum if you're offering health insurance coverage. Also, elimination of pre-existing condition if an insurance carrier is providing coverage for child-only coverages. They cannot exclude pre-existing conditions for those children. All right, that came into place as well. Now, the law really didn't have too much impact on people age 65 and older, or in essence, the Medicare product. The law really deals with commercial insurance, 65 and below. The one part where there was some adjustment was with the Medicare Part D, which is there is a component within the prescription drug program called the donut hole. And under this law, that donut hole is going to be going away over the next 8 to 10 years. Some of the other things, grandfather status. Who has heard the term grandfathered in the last year or so as far as their health insurance program that is out there? What that meant is this. If you had a program effective March 23, 2010, and you made no changes to it, No changes to it. Didn't change your copay, didn't change your deductibles, co-insurance, and the other things that go along with the health insurance program. You could keep your program throughout. You did not have to go into an Affordable Care Act compliant plan January 1, 2014. And there are some people who are on a grandfather program. In general, there's between 10 to 15% of the individuals that have an individual policy are still grandfathered, but less than 2% of the group policies are grandfathered. There's also a small business tax credit that's been out there for a couple of years. If you have a business less than 50 employees, you may have been eligible for a tax credit. You need to take a look at that. There's also been some limitations on the medical flexible spendings account programs. Up until this past year, if you offered an FSA to your employees, that employee could put up to $5,000 into their medical flexible spending account. That was changed last year to $2,500. That was a pre-tax deduction that has been limited down to $2,500. Here's something that everybody in the room should have received in the last couple of years as their plan renews. It's called a Summary of Benefits and Coverage. SBC is another acronym for it. It is a very standardized program by which the insurance carriers must provide to the members of their insurance program a 4-page, 8.5 by 11, typed out exactly what their benefits really mean. It kind of is a dummy's version of their health insurance product. What their deductible is, what their co-insurance is, what their office visit, and how it plays out. Also, 2 examples of insurance coverage has to be outlined in the Summary of Benefits and Coverage. One, if you have type 2 diabetes and how your plan affects you, and number 2, for maternity coverage and how that plan would impact you. The other thing is, that's been implemented over the last few years, is a medical loss ratio. Who here has received some type of a rebate check from their insurance carrier in the last year or 2? Anybody? I know I did. Basically what it means is this. If an insurance carrier is providing insurance coverage in the state of Missouri, and in the state of Missouri, if their medical loss ratio, if you're providing coverage for individuals, is less than 80%. And I won't go into details how they come up with that 80%, but basically it's, are they spending 80% of their medical dollar from the premium that they're taking in? Are they spending it on the medical expenses? If they're not spending at least 80% of it, then they owe you some money back. And that's what happened in the form of a rebate check. And a lot of people have received rebate checks. I know United Healthcare, Coventry, as well as Anthem Blue Cross in the St. Louis marketplace. In the last couple of years, they provided those rebate checks. Now, January 1, 2014, that's when everybody kind of thought, look, this is when the Affordable Care Act takes place. Well, in reality, I've just shown you a number of things that have already been in place. It's just that January 1 of 2014 is when there was a lot of noise out there in the media and everything, because on January 1, 2014, everybody has to have health insurance. You had to get it through your employer, or you had to get it through an individual program. All right? We're going to talk about that. But also, January 1 of 2014 was the establishment of the Health Insurance Exchange. And we're going to talk a little bit about what an exchange is. Another name for an exchange is the marketplace. It just is another vehicle by which you can purchase health insurance. There's also rating restrictions that went into place January 1, 2014, as well as the total exclusion of pre-existing conditions if you're purchasing a program. Essential health benefits, EHB. If you're an individual or have a small business, by the way, is employers that have less than 50 employees, you have to have a plan